Hello everyone, my name is Dr. Purudhavan and today I will be talking to all of my viewers about how much water a kidney disease patient should consume in a day. With this, I will also be shedding some light on the effect of consuming excess water by CKD patient. Water constitutes around 70% of entire body of healthy human being. With this, keeping yourself hydrated is necessary. But in a kidney patient, even drinking a normal amount of water can have a opposite direction. Let me explain to you how. Whenever an individual consumes water, it is circulated throughout the body. After it has fulfilled its purpose, the kidney treat the extra water which is excreted from the body via urine. Now, in a kidney failure patient, the process of this filtration is reduced, thereby not letting the extra water leave the body by urine. This is where all the problem starts. With the excess amount of water not being able to flush out of the body, it accumulates, often leads to pedal edema, pneumonia, and high blood pressure, and even breathlessness. Often we see that kidney patients have swelling in their lower part of their legs at the start. Now, for the scary part, while you see water retention in your legs, it doesn't take long for this fluid to travel to an individual's lung, which can stimulate a drowning like feeling correctly in many situations. Coming to the main question now, on how much water should we consume by a kidney failure patient? The answer is no one knows. You heard me correct. Often I see my patient comparing themselves to other patients regarding the amount of water intake. To this, I always have the same reply. Every kidney patient's water intake depends on the several factors. From the level of kidney functioning the patient has to the climate he or she is living in. There are other factors such as skin type and profession, all of which play an important role in the deciding the amount of water that can be consumed by a kidney patient. Therefore, a person living in a cold climate will sweat less, thereby making fluid consumption go down, and vice versa. Now, coming back to the main question again, how much fluid can a kidney patient consume? Well, what if I tell you it depends on the condition of the patient? Let me explain to you. If a patient is suffering from water retention in his or her legs, this means that the body already has an excess amount of water. In such a situation, my advice to all my viewers would be not to consume more than 500 ml of water per day. With this, it also becomes important for a patient to urinate more so that the excess fluid can be thrown out in less period. On the other hand, if there is no retention of water in a kidney patient, my advice would be to take extra precaution while consuming water. I usually tell my patient not to consume more than 100 ml of water at one go and repeat the process whenever there is a feeling of thirst. It is completely normal for a person to feel thirst as it indicates that the fluid level are less than normal. Some common sign of this would be dry lips, throat with difficulty in speaking. Under such situation, a kidney patient can consume another 100 ml after 5 to 10 minutes, which will make sure that the fluid level do not rise and feeling of thirst is gone. This exercise also removes the need to keep a tab on how much fluid has been consumed, as drinking small amount at intervals will not let any fluid accumulation take place. Let me make it simpler. There are two reasons for the fluid accumulation to stop when following my advice. Firstly, the patient only consumes water whenever there is a feeling of thirst. And because the water is consumed at interval, it gives the body time to produce urine and throw out the excess fluid. Therefore, the process of fluid accumulation doesn't take place at all. And this in turn lets the body through other waste materials such as creatinine and urea out in a proper manner, which will for sure improve the functioning of the kidney as well. So we are not only not letting the fluid accumulation take place, we are also getting the body to throw out the extra waste which usually gets accumulates in the body of a kidney failure patient. Every kidney patient must follow this exercise if they want to be relieved of swelling in the leg as well as the other complications like the fluid traveling to the lungs resulting in a collapse. With this, we have reached the end of this today's video. I hope I was able to clear all the doubt regarding how much water should be consumed by a kidney failure patient as well as the consequences of having too much fluid. But still, if you have any question, you write them below in the comment section and I will be helping you all in every way I can. Till then, take care and I will see you in the next time.